And we're live. Hello, everyone. Welcome to the webinar on AMR Advocacy, which is a webinar which is in relation to the amazing advocacy toolkit, which was made by the RA for SCOF AMR and the small working group. So before I start to go over the agenda of the meeting, I'm just going to ask everyone to go for every speaker to introduce themselves. So Omnia, do you want to go first?
Yes. Hi, everyone. Good evening. I'm Omnia Al-Omrani. I'm the SCOF Regional Assistant for the AMR, and it's my absolute pleasure to facilitate this awe-inspiring webinar on AMR, which is my regional priority for the term.
Thank you very much. Saad, would you like to go next?
Hello everyone, I am Saad Wakas from Morocco. So we are conducting an activity on AMR and I can't wait to present it to you.
Thank you very much. Mahmoud?
Yes, hello everyone. I'm Mohammed Mnir from IFMSA Egypt. I'm really pleased to join this webinar today to introduce everything about our new toolkit to you.
Very much. Yannick? Yannick, your microphone's muted.
Perfect. So I'm Yonne, which I tried to say already. This year I'm the liaison officer to student organizations, and that also includes coordinating the advocacy IFMSA does globally on antimicrobial resistance. I'm really happy you're having this webinar, and soon I'm going to introduce a bit what we do globally and what are the big global processes related to AMR at the moment.
Thank you very much. Omar?
Hi everyone, my name is Amal Abaid and I'm the National Public Health Officer from Associamed Tunisia. So I'm extremely honored to be presenting the activity on antimicrobial resistance that we did, and I can't wait to be among you today. Thank you.
Thank you very much. So hello everyone, my name is Nishwa. I'm the SCOF director for this term. And again, I'm as excited as all of the speakers to be having this webinar. So what I'm going to do now is go over the agenda, and I'm going to start presenting to you the slides. Okay, I hope you can see it. Okay, so the antimicrobial resistance, which is the SCOF priority for Eastern Mediterranean region. So in the agenda, we have firstly the introduction to AMR. The second thing is the current antimicrobial resistance situation. Then we're going to move on to AMR Advocacy Toolkit, which is about to be released. So Omnia is going to go a little bit over it. And then we have two examples of activities which have been happening in AMR in two of the organizations. The first one is Associamed and the second one is IFMSA Morocco. And then we're just going to wrap up with some questions. So be prepared for that. So we're going to start with something very basic, which is why AMR. We all know that antimicrobial resistance is the ability of a microbe to resist the effects of medication that once could successfully treat the microbe. Why is it an issue globally right now? We expect that by 2050 we would have 10 million deaths due to antimicrobial resistance, and it would have an economic imperative which would be very costly, as to 66 trillion pounds, which is a lot. And we do point this out to the fact of, on our behalf, as a failure to address this problem. So something special about antimicrobial resistance is that it has been around for a while, and it is one of those public health issues which we call irreversible, as to something which would be very difficult to fix once it is being worsened. So just a little bit about SCOF and AMR. AMR has been a priority for SCOF for a long time. This year we had two regions whose regional priority was SCOF. The first one was EMR, and the second one is Europe. And in the global external focus areas this year, we also added AMR. In SCOF, we do the first thing which we do a lot regarding to AMR are PHLTs. So we have multiple PHLTs which happen on AMR, which are workshops which empower medical students to be able to start up projects in their own NMOs regarding and on AMR. And the second thing is we have been having sessions in every GA. We have been, and this is the toolkit that's going to be released. And we also did a campaign this year on AMR. Additionally, we also have a public database which has resources, a resource document which was made by the RSCOF of Europe about all the resources that you can find on AMR. So this is just an introduction to why we're addressing AMR and as to what SCOF has been doing with the topic of AMR. So I'm going to move forward and leave the floor to Yonne for global processes in AMR.
So yes, when we think about AMR, so first from maybe an IFMSA point of perspective, so this is actually the first year that we have AMR as a global external focus area. Last year, we worked on AMR in the European region, but we haven't really done it globally yet. And basically the reasons why it was chosen as a global external focus area was the fact that there's been a growing interest, obviously also awareness around the impact of AMR among IFMSA members. But what's actually funny is that even though inside the medical field we've known for quite a long time that AMR does exist, WHO has had discussions on AMR for maybe tens of years, but nothing has really been done before 3 years ago, when there was a really big process inside the WHO to create the first ever global action plan on antimicrobial resistance. It was basically the first global plan which kind of made the targets, kind of made an outline on what AMR is, what is the situation around it globally, and what should WHO do to basically tackle it. After that, things kind of started rolling, and in 2016, there was something called the O'Neill report, which was published. O'Neill report was done by the government of United Kingdom, and it was basically the first big report which kind of outlined the impact that AMR could have across basically humanity, and also what is the costs. So basic the numbers that Nishwa just mentioned. So 10 million deaths annually by 2050, and 66 trillion pounds by 2050. So those numbers actually come from this O'Neill report. Then happened a really big for health topics. So in 2016, there was the high-level meeting on AMR, which was held at the United Nations General Assembly. For those who are not really familiar with the United Nations in general, so what is maybe a bit surprising, the health topics are really rarely tackled at a high-level meeting. A high-level meeting is basically the highest level a topic can reach inside the UN system, and it is a meeting organized usually during the first week of the United Nations General Assembly in September. AMR was only the 5th topic, a health topic, the previous ones being HIV, Ebola, NCDs, and something else which I'm missing. And basically, it was a really big thing because this is not something that happens every year. What basically this high-level meeting led to, it led to a creation of a political declaration by the United Nations General Assembly. What this means from when you compare to, for example, something like a decision done at WHO is that when such a decision is done at the highest level of the UN, it usually involves the heads of states. And when such a decision is made, it carries much more political power and basically pressure on the governments to do something about this topic than a decision done at WHO. So it was a really big thing. Then what this political declaration led to was the creation of something which I'd call like a small working group on AMR. but basically at a really high level. And that group is called the Interagency Coordination Group. If you ever want to work on AMR advocacy, well, at least for the next 5 years, so basically the most important stakeholder you should know is the Interagency Coordination Group, or in abbreviation IACG. IACG is basically composed of many representatives from big UN organizations. So, for example, it has representatives from WHO, FAO, which is the Food and Agriculture Organization, OIE, which is the Animal Health Organization, UNICEF, and many others. And basically what they do is that throughout the next year, by June 2019, they're going to basically deliver a final report on what needs to be done on AMR globally. It's really exciting in a way, because this report will most surely basically determine the global actions done on AMR for maybe the next 5 or 10 years. So this is definitely the single most interesting process which happens at the moment. IFMSA has also been included and active in the work of IACG, both as an active civil society member, but also basically going to the civil society hearings and interacting with many stakeholders, for example, at the World Health Assembly. But that's basically when it comes to the global processes we happen at the moment. Can I have the next slide? Something which is related to this and is basically an IFMSA initiative is something called Innovate for AMR. I wanted to bring this out because this basically is the biggest thing which IFMSA has done on AMR during the last year. So what we've been doing is that we've been trying as IFMSA to kind of find different ways to kind of engage on AMR and basically able to bring the students' opinion to the table. And one of the ideas we basically had was to create a kind of an innovation competition, previously under the name of the hackathon, which most people don't understand, so we changed the name. We had basically a preliminary version on this at the March meeting in Egypt. But after that, we've been quite heavily planning to do a bigger one, which happens online. I'm happy to say that we're launching it really soon, in the 1st of August. And I'm really happy to say that we've found really, how would I say, prestigious partners. So with IFMSA on the project, we have the Johns Hopkins University and the School of Public Health. And then we have REACT, which is an NGO working on AMR. In addition, we are likely to be also supported by the WHO. And the prize, which we're still kind of deciding on, will likely be that the best ideas we have for the Innovation Challenge, the best teams will be chosen to attend a capacity building event on AMR during the World Antibiotic Awareness Day in November. And this will include for most members of the team that actually all the travels to the destination will be played. So in case you're really interested about doing advocacy in IFMSA on AMR, so I do suggest you participate in the competition once we launch it, which will likely be done at the 1st of August. Oh yeah, that was it for the most part. And I'd move on the word for the next speaker.
Thank you, Yone. So Omnia is going to talk a little bit about the AMR Advocacy Toolkit and just give you a bit sneak peek.
Okay, so thank you, Yana. If you're the passionate advocate that Yana's just talking about towards the critical global health issue we're talking about, which is AMR, then this toolkit is for you. Based on the beautiful work done by my small working group and the small working group coordinator, Ms. Ghaida Siddi, this toolkit, we created a toolkit that is basically an enriching journey throughout the 4 aspects of what we call the umbrella of advocacy. So basically, our toolkit is based on the umbrella of advocacy, which is a concept of activity management. This concept has 4 main pillars. The first pillar is research. So basically, research is knowing your cause, so that you can conduct an activity, an evidence-based activity on AMR. You need to know your cause, you need to know the statistics and what is leading to the issue and the facts behind it. The second part of our advocacy toolkit is networking, which is knowing your people, knowing the stakeholders, knowing who to contact to further increase the impact of your activity, as well as knowing your target groups and how to efficiently deliver public awareness messages and how to be able to tackle the AMR problem, knowing who to contact and knowing the right people for it. The third pillar, which is campaigning, which is basically what you do. And our campaigning aspect starts with knowing your vision, knowing your mission, what is your goal, why are you doing this activity, and then we're going to help you explore a variety of methodologies and the way to efficiently evaluate this methodology and to assess the impact you've done so that you can accomplish by the end sustainability of your activities, all in relation to AMR and how to apply it on antimicrobial resistance. The final pillar, which is lobbying, and lobbying is concerned more with working your way up. Working your way up means the policy-making aspect, which is the next step after you target the general public and your other target groups related to AMR, and how to help your government and help policymakers acknowledge the AMR threat and the problem and the consequences of it, and how to tackle it, how to address it, how to involve it in the governmental and in the policies applied in the national action plans within your own NMO or within your own country. Next slide. So now I'd like to break down and give you a small overview on each pillar we have. First, which is the AMR situation in EMR, since this toolkit is specific to EMR and EMR stakeholders in a way. The research pillar, which is the first pillar in our toolkit, basically provides you with researches done worldwide and as well as in EMR that prove the immensity of the AMR threat. And it discusses many researches that's been done. For example, there was a study that was done in Jordan in 2013 and proved that 40% of the Jordanian population self-medicate. As well as it proved that in Egypt, another study proved that 30% of the Egyptian population in a study done in 2 teaching hospitals, 30% of them also self-medicate. And since EMR is a region that allows over-the-counter use of antibiotics, there is an immense lack of knowledge and lack of awareness of how AMR is a threat. And this is just a glimpse of the researches and what to expect when you're reading this part. And hence you can use it when you start delivering your key messages to your target group. Which brings me to the next slide, which is the networking part. So the networking part basically is a kickstart or a glimpse of the many stakeholders that you can address, that can help you and you can get their support throughout your activity, whether they are international partners or international externals that you can contact or you can use their seek their guidance or their help or their support, as well as we've included local stakeholders in AMR countries. So since AMR has always been a multidisciplinary concept, a multidisciplinary issue that has many stakeholders that does not only include the human health, but also environmental and animal health, there's a diversity to its target group. So the One Health approach will be further explained by the next speaker. But what I want to highlight now is that there are many stakeholders you can address and you can use the help of health organizations, of the organizations that are related to the animal and the food industry, as well as other student organizations like IPSF and that of veterinarian or dentistry students. And we have included all these stakeholders, as well as the stakeholders locally in particular AMR countries. And finally, I'd like to take the floor to the next speaker to talk to you about the remaining 2 pillars in our toolkit.
Thank you, Mia. So now we're going to be talking about campaigning. What?
Okay, hello again. Concerning the campaigning, first of all, I would like to say the definition of campaigning in order to understand what we'll be talking about. Campaigning, if we can define it, it can be mobilizing public institutions or specific group concerned to organized actions in order to achieve a social, political, or commercial aim and induce a behavioral change. And that's exactly what we want in our AMR advocacy journey. First of all, we need to understand what's our vision. And to understand what's our vision, we need to understand what's the vision from the beginning. The vision is to understand why am I doing this? Why am I advocating for AMR? And why am I doing what I am doing? I need to understand the purpose and the motivation for example, the AMR advocacy campaigns, for the AMR advocacy toolkit. We're preparing everything. I need to understand my vision. Why am I doing this? It should be idealistic, utopic, and it needs to seek perfection. And it aims to work toward the future. That's the vision. For example, if we give an example concerning AMR, the vision or our vision for AMR advocacy is eradication of AMR, and that no more people will be suffering from AMR or dying from AMR-related effects or causes. That's the vision at the beginning. After we prepare our vision or we know our vision, we should know our mission. The mission is how are we going to do our vision in the present, which means the steps that we're going to take in order to achieve our vision. It should be reachable, realistic, directional, and time-bound. For example, concerning the AMR, as we have said from the beginning, the vision is eradication of AMR example. So our mission should be that medical students should be competent and should know the basic knowledge they need in order to achieve this vision. And for example, we should gain governmental support in our AMR advocacy journey. That's the mission concerning our vision that we made from the beginning. The next step is to define our goals, how to follow that mission. What should we do and who will benefit from what we're going to do? It's like the station that we're going to pass by in order to reach our mission, which is the top that help us to reach our vision. For example, our example in the AMR advocacy, as we have begun, our vision is eradication of AMR. Our mission is that medical students should be competent and we should gain governmental support. And our goal should be equipping medical students with everything they need from skills, knowledge, and information they need to understand the root causes of AMR. The last thing is objective. What do I need to do in order to use this goal? There are specific resources that help us complete the goal as a methodology. For example, in our goal, as we have said, that equipping medical students with knowledge to understand the causes of AMR. So our objectives will be that we should, for example, prepare workshops, we should prepare training sessions, we should give like webinars on AMR, giving them knowledge and information about the causes and effects of the AMR. And these are the objectives. So the most important thing of the objectives, that they should be SMART, which means specific. Like we have to ask ourselves, who are we giving this, for example, campaigns to? What are the campaigns about and how they are going to take place? It contains everything about the methodology. And the second thing, it should be measurable. How I measure this step? For example, including numbers, dates, percentages, all these are statistics that help us measure our objectives. And the third thing is it should be achievable, that it can be done. It should be realistic and reasonable. And the fourth thing, it should be relevant to our goals and visions. And the fifth thing, it should be time-bound. Like we should have a clearly defined time frame, including our target, deadline for each and every step, not just the deadline for the project, but for every step we're taking, every objective and every goal. That's about the objectives. And above all, above the vision, the mission, the goals and objectives, we should know our problem statement. What is our problem here? What are we fighting here? We should know that, for example, in case of AMR, we should know the causes of emergence of the AMR, which may include, for example, the misuse of antimicrobials and the overuse of them, and what caused their spread, such as the favorable environment, individual hygiene problems, and poor infection control in hospitals and clinics. These are our problems. From these problems, we can define our problem statement, and then we can define our vision, mission, goals, and objectives. If we can define also the key elements of an effective awareness campaign, this can include research, which help us which help us find our selection, help us in selection of target groups and the materials, and then setting targets based on our problem statements, the goals, and the validity of our cause. We should plan campaigns conducted by an appropriate leader and supported on political, social, and media platforms. We should use our right skills to design an appealing, tailored content to the audience. We should use communications brief. And what's a communications brief? Is to use all the information we collected to set a personalized guide in our campaigns. We should seek expertise to develop high-quality campaign. We should know how to approach our audience, and we should evaluate our impact and repeat the campaigns with better and improvement. If we can talk now about the methodologies of the campaigns, we have 4 types, and of course there are much more, but the main 4 types are, for example, workshops, which work mainly on the knowledge and the skills of the trainees or the people who will be attending the workshops. It may include physical campaigns. We'll be meeting different actors, and we'll be encouraging them and giving them more information about the AMR. Online campaigns, where we can find much more people on the social media platform, and conferences, where we can meet policy makers and decision makers and help them see what we have achieved and help them see what we are advocating for in order to help change the policies. Which you can find also in the toolkit when it will be published. You can find the target groups that we have reached, which are general public, the farmers, agricultural sector, dentists, doctors, pharmacists, hospitals, clinic managers, midwives, nurses, healthcare workers. Those are the target groups that the WHO have encouraged us or on their websites in order to advocate the AMR with them. And last thing about the campaigning is the evaluation. The most important thing about our campaign is should we evaluate. We should see, did I achieve on my goals? How well did I achieve? What need to be changed and what need to be improved? This can include 2 things: feedback, which evaluates the methodology I chose in my objective on the target group. For example, I should ask myself, was it appealing? Was it suitable? Should it be done again? And in addition to the feedback, we should see the impact assessment, which can evaluate the success and the reach of the activity, previously setting the goals and objectives. By asking myself, were the objectives reached? Were the indicators of success reached? Is the goal fulfilled? These are the questions I should be asking myself in the feedback and impact assessment in order to evaluate my campaign. I will be giving only one example in order not to waste too much time on this part concerning the evaluation. For example, if I am having an online campaign, the feedback would contain online poll on likability, follow up on the number of likes, shares, and comments, follow up on the reach and views, and follow up on its spread on different social media through the SCOF members worldwide. And the impact assessment would include online knowledge testing poll shared on the same pages, online quiz, follow up with the national officers on any questions regarding the info shared in the campaigns by the members. This is an example for the feedback concerning the online campaigns and the impact assessment. That was about the campaigning. And now with the next slide. It's the lobbying. The lobbying, there are 2 types of lobbying, direct and indirect. If I can define the direct lobbying, it's any attempt to influence new or existing legislation via communication with a member of the legislative body or government representative who had a say in the legislation. By meeting with the decision makers, discussing issues, arguing the causes, and making recommendations. While the indirect lobbying includes asking the general public to contact their legislator or mobilizing the public around the legislative issue, which is in our case, the AMR. Why here we can see in the slide, we can see the One Health approach, which has been defined by the WHO as collective efforts locally and globally in order to ensure that all these health, the human health, animal health, environmental health, are all working with one another in order to reach more upper goal, which is the One Health. All these healths are related to one another. For example, we can see that the humans and the animals are related with each other in the comparative medicine. The animals and the environment are related in the ecology section, and the engineering and the human are related, the environment and the humans are related in the engineering section. So each of the different health, the animals, the humans, and the environment are all related to one another, especially concerning the AMR. For example, the AMR in the animal health, we use the antibiotics in order to treat animals, in order to code them to, for example, in case of cows, to deliver more milk. So here to treat them from the infections. So here the AMR is caused by misuse and overuse of antibiotics and antimicrobials in the animals. And the same goes for the humans, the misuse and overuse and abuse of antimicrobials for treating the human infections. And in case of the environment, in the agricultural section, when they use the antimicrobials and the antibiotic, in case of the to treat the crops from the infections too. So the lobbying takes some, like we can say, some steps in order to get the lobbying to be most successful. The first thing is to know the current situation on the AMR by research, plus most importantly evidence to support our intervention. If we're going to talk to a policymaker or decision maker about our advocacy for the AMR, they would not listen to us if we do not have statistics, data, or scientific evidence about our concerning our talk. If we don't have any evidence at all, they will not listen to us, and our advocacy would unfortunately fail. So that's the most important step, the first step, and then we should study the opposition and the stance decision makers hold regarding AMR in our country, plus the type of intervention they take. And we should study the political process in our country by asking professors of law or interfering with the political process. And we should define our problem statement, which legislation to engage, any possible compromises to be made, reasons for such a choice, and amendments. And we should understand what the reaction of our lobbying can create on political figures and media and work on our timing. And establish strong network of local, national, and international stakeholders to support us. And connect successfully with supportive political figures from the inside, which can be the hardest step, because reaching a political figure who can support us toward our advocacy with the government can be somehow difficult, but not impossible. And the eighth step is contacting media by saying, for example, what our case is, what are we looking for, who is involved, and when our campaigning events will take place, and backing up our direct lobbying with indirect lobbying by, for example, making events, either events on the physical campaigns, for example, or making events on the social media. These are indirect lobbying that contact the public and in the same time help us in our direct lobbying. And the 10th thing is ensure that there are no open disagreements with our campaign. And the last step, which is the most important one, keep up campaigning until succeeding or reaching a dead end. Never lose hope. As long as you're doing the right steps, as long as you're advocating and doing what you should do concerning your campaigning, your lobbying, and as Omnia said, your networking and research, you're 100%, I'm 100% sure you'll reach your goal. Maybe not this year, maybe not next year, but you will reach it. And at this time, you will be really over the moon with all the efforts you have done. That's all about campaigning and lobbying. And I'm sorry if I took too much time.
Thank you very much, Mom. And we're going to move on to the NMO example for the for AMR, which is actually PHLT. So, Amal, would you like to start?
Yes. So to begin with, our NMO is implementing an AMR program for the first time. And our plan is basically inspired from the WHO process, which is composed of 5 steps. The first step was to build it, is to create the National Action Program on AMR. The second was teach it, is raising awareness campaigns, training, education. The third is check it, monitoring and feedback. Fourth, which is to sell it, reminders and communication. And finally, the fifth one is to live it, the culture and change and behavioral change when it comes to antimicrobial resistance. So we have started actually by establishing an advocacy plan targeting decision makers and relevant sectors. And our partners were both governmental and non-governmental organizations. NGOs such as the Tunisian Ministry of Health and the National Technical Committee for tackling AMR. And we have also strongly recognized the importance of working together to ensure synergy and the need for an integrated approach at global, regional, and national levels. And this is why we established official partnerships with other Tunisian health students NGOs, such as pharmacy, dental, and veterinary students. So our activity had basically 3 types, which are education, advocacy, and campaigning. And we made sure that this activity is in line with our NMO vision and mission, targeting mainly medical students. However, beneficiaries included also other health students and general public. First of all, as I enrolled my activity in the FMCI programs, I had the chance to review the program strategic planning with the program coordinator. And we set up 3 goals, like Mohammed was saying, which included educating medical students and the general public on AMR, as well as educate them on health and animal and human health. And finally, to equip these students with the tools to critically examine antimicrobial strategies on different levels and advocate for changes. By this activity, we are seeking two outcomes. Outcome number one is about improving knowledge and empowering medical and other health students on this specific issue. And the main indicators that we set were the number of students trained and attained the number of activities on local and national levels, as well as educational materials. And number two is how much these medical students are involved in developing and implementing programming on AMR that are either student-led or NGOs. And the indicators were the number of meetings, congresses attended, etc. We believe that we have succeeded 2/3 of the program. So I'm coming actually now to the follow-up part, which have, as for education, on a national level, we have succeeded to make out a PHLT workshop, which is an SRT, an AMR, gathering 20 health students, medical, pharmacy, veterinary, and dental students I've been telling you about, from all LCs of SSM Tunisia and different NMOs, LMSA Libya. And we made sure to provide these public health trainers with a survival and follow-up kit, as you can see on the screen. And later, we had 2 sessions at the National GA on AMR attaining 30 students. We also designed an infographic on AMR to be released soon. This is for the national level. On a local level, a set of training sessions in each LFCs are to be taking place. So to group it all, up to now, we have trained exactly 70 members and are expecting to train around 60 more by October. And 4 training sessions took place, and we are expecting 5 more to happen in LCs at our next GA. Now, when it comes to advocacy, which is the most important part, SSM Tunisia happened to join 2 out of 3 meetings with the National Committee for Tackling AMR during the previous term. And this committee is basically an advisory committee which works on raising awareness, campaigns, education, and trainings on AMR within human and animal health professionals. So in 2018, Tunisia has started developing its national action plan on AMR following the WHO recommendations. And SSM was present in the National Congress for implementing AMR on February 2018. It was mainly an opportunity for it was a national consultation, actually, gathering WHO, EMRO, FAO, OIE experts, and Tunisian stakeholders, including NGOs from different sectors, under the roof of One Health, as Mohammed was saying. After that, the development of the National Action Plan didn't end there, because it was followed by 3 meetings, and we were around 5 people, actually, only 5 from different sectors working on the final documents. And by the end of February 2018, the plan was successfully submitted to the WHO. So I believe that taking part in this event was of a great help for our NMO, because it helped us mostly when it comes to developing and refining our NMO activity. Meanwhile, our SCOF national team is working on a policy document on antimicrobial resistance to be presented on our next GA in September, and I'm proudly of them. And last but not least, campaigning is yet to happen from August to October, targeted, as I said, medical and other health students. And the next campaign is taking place in one of the LCs next week, and we're expecting to reach around 100%. So eventually, we're quite satisfied about the work done here, and most of all because this first-time activity that shall grow bigger in the upcoming years. Hopefully, within 5 to 10 years, we'll be lucky enough to witness the ultimate step of the program, which is tackling the irrational use of antibiotics in both animal and health sectors. So this is a review, let's say, about our activity. If you have any question or anything, thank you for having me.
Thank you very much, Amal. Really
Thank you, Nishwa.
Great activity. So I'm going to move on to another activity from IFMS in Morocco. Saad, would you like to go ahead?
Okay, thank you, Nishva, and hello, everyone. So, starting with a fun fact. So, believe it or not, the last time I took an antibiotic was 15 years old when I was a kid. But unfortunately, this is not the case for 38 million people living in Morocco, where you find that there is an overconsumption of antibiotics by everyone. And the reasons of that problems are mainly two. The first one is that the general population lacks knowledge and awareness on the proper use of antibiotics. And the second reason is that health professionals like doctors, like pharmacists, are not really responsible on that point. They are not taking an active role. Instead of making people aware, they just simply provide them with free antibiotics without a need. So those were the causes. And it all started with a simple observation by two of our amazing members that I salute, by the way. In the start of the term, they decided to act on it. So we started small steps. We made a video that we filmed ourselves, and then we shared it in social media. And within 2 weeks, the video reached more than 80,000 views. So we were really glad about that. So we followed out by making articles in local and national journals and also in social media. So we were able to make 8 articles. As you can see in the picture, that's one of our articles in Hespres, which is the most seen online journal in Morocco. And followed by that, we went for TV and radio shows. We had 2 radio shows where we talked about the topic. And also we went on a TV show. You can see the picture. It's also in the news. It was a TV news shown in the picture. Another thing which followed is action in the field. We started having posters. We made posters in Arabic and French, also in English, that we started sharing and posting in public places to make people aware on antimicrobial resistance and the bad or the risks of overconsumption of antibiotics. And also we went for medical students. This was our second target group. We went for medical students by doing conferences and presentations in our classes. In this term, we were able to reach 2,500 medical students in 2 faculties, and we with pre and post assessment, of course, so to make sure that our conferences had an impact on them. So those were the main actions that we were making. Followed by that, we had meetings in order to advance in the advocacy part. We had meetings with our dean, with professors, in order to discuss how we can implement AMR in our medical curriculum so that future doctors will be able to have more knowledge and more responsibility on antibiotic use and AMR. We also had meetings with the veterinary and dental medical students associations here in Morocco to plan so that we can also make awareness for dental students, for veterinary students. And also we had meetings with the syndicates of doctors of here in Morocco in order to see how we can collaborate with them in order to implicate doctors more and more on the topic. And I'm glad to tell you that yesterday with our meeting with His Excellency the Minister of Health, it was one of the points that were discussed in the agenda, and more actions will follow in the future. So this was the first term, the first year we started working on the topic. We were really glad to reach those actions, and we hope to keep working on it, small steps, as I said, in the future, reach more general population, reach more medical students. And of course, if you have any questions, feel free to ask, and feel free to contact me in person or contact the activity coordinator. And as I always say, life is like a bamboo tree. You need 5 years to make it grow, and it only grows at the last year. So keep advocating, keep campaigning, and keep working on it. Even if you don't see results at the time, results will come. Just go with small steps and you will do a great job.
Thank you so very much, Saad, for the motivating message. So now we're going to move on to questions. If you have any questions, please feel free to post it on our YouTube page or on our WhatsApp group or even on Facebook. So I'm going to stop sharing my screen. for now. And I'm going to look for some questions. So we don't have any questions, so we're just going to wait for a while for some questions. And in the meanwhile, I'm just going to present my slide. And Omnia, would you like to talk a bit about, would you like to share about the small working group?
Yes.
Okay, here they are.
Yes. Okay, so thank you everyone, and thank you Saad and Amal for the amazing activities and the way you explained it. And this is just a glimpse of the examples that we've had and we've included in our toolkit so that you can see what other animals in the AMR are working on. We've also included activities from Algeria, from IFMC Egypt, and many more. So I would like to give a big shout out to the amazing small working members of my small working group that did this work, and they were working day and night, and it's been so amazing to have them. I'd like first to thank Ghaida Sadi, which is the small working group coordinator, and she's been amazing. Also to the beautiful members, we have Sado Kas, who is a member of the small working group. We have Khadija, Shamarka, Muhammad Mamdouh, Moheb, Omar Dawood, and Haider. Thank you all so much, and I can't wait for you all to see our toolkit and to make the most out of it. And at the end, our main goal is to equip you to confidently tackle this topic. And as Muhammad said, and as Saad said, it might take a while, it won't happen just now, but as long as you know your vision, you know your mission, and you know your goals and objectives, you have the variety of methodologies to achieve it. And by this, you can help as a future healthcare professional, as a medical student, you can help tackle this global burden and stop this post-antibiotic era that we might suffer from through your advocacy and through the tools and skills that we would like to give you and would like you to make the most out of. Thank you so much, everyone, and I hope you enjoy our toolkit and this beautiful journey we've created for you.
Thank you very much, Omnia. So we do not have any questions for now, which I think I take as a good sign. We're just going to wait for 2 more minutes if anyone has any questions. I see a lot of viewers. That if you have any questions, please let us know. Otherwise, we'll think that we did the webinar very well explained. Okay, so I think we have no questions currently. And thank you everyone for your general comments. So I'm just going to throw in a question. Yoni, could you explain a bit more as to what will happen when the ICAG is going to submit the report in the United Nations high-level meeting, and to what extent do you think that the national organizations, that the countries would have to follow the next global action plan?
So the first question was related to IACG. Can you elaborate? What was the question? Can you repeat it?
Yeah, so the question is that you mentioned that the ICAG is supposed to submit a report in the UN high-level meeting. So just as to what would be the outcome, what is the expected outcome of the United Nations high-level meeting, and what can we expect as to, so there will be a global action plan, but how can we expect countries to be following it, etc.?
No, that's a good question. So basically, when the IACG will submit the final report by next June, so the report will go to the UN Secretary General Antonio Guterres, and he will then basically do the next preparations related to how and when it will be brought up in the agenda of the United Nations General Assembly. So to kind of elaborate what that means, so actually it is fairly exciting on what will the outcome be, because nobody really knows. IACG will make recommendations to the UN Secretary General, but what the UN Secretary General then will do by himself is still something which we don't really know. I would determine it likely that it will come up as an agenda point at the UNGA next year. But how, what will be the outcome? So that is yet to be determined. But basically, to kind of frame it on the background of the high-level meeting which took place in 2016. So basically, now the IACG is the global coordination mechanism on AMR. So basically, their term will end by June 2019. So I think it will be likely that at the UNGA, I hope that there will be a decision on what will be the global coordination mechanism to kind of coordinate actions on AMR after the term of the IACG expires. So that's definitely one thing. Obviously, second thing is like what kind of recommendation, what kind of commitments will we see by the member states related to kind of tackling AMR as a whole. But basically, at the moment, it's really hard to tell. And I'd say maybe the one big thing which I'm worried about is that when we think about AMR, so when we compare to, for example, HIV, so HIV has a really strong civil society movement supporting HIV. When you think about, for example, the history of HIV, how it was really the civil society that really pushed HIV and AIDS up on the global health agenda. But it hasn't been the case with AMR. AMR doesn't really have a strong civil society movement because it's a bit of a new topic. And when you think about AMR in the media, just the word AMR, so even most medical students don't really know what it means. So it's really kind of hard to kind of build the same kind of story around AMR as it was with HIV. And what this basically means that it's been a challenge by the civil society and also by WHO and other organizations to kind of engage the civil society. And the reason why this is so important is that if there's no civil society, who will be there basically to push for something to be done on AMR if the member states don't really feel like doing anything? It's likely that they do want to do something, but when you think about global diplomacy in general, so it's usually the civil society that really has to put the pressure on the member states to make them committed to something. So it will be really interesting to kind of see how the next 12 months will go. Will the civil society be able to engage more in the process? There's been some actually changes in the IACG, I'd say, towards a better direction of involving the civil society. So I'm hopeful. But once again, it is the most important year on AMR advocacy for at least maybe 10 years. And I really hope everything turns out right. But it kind of also highlights how important next year and this year are for IFMSA to basically advocate for our points in AMR, because we won't be getting a better opportunity to actually affect the global agenda.
Thank you very much, Jenny. I think that answers the question very well. So I'm just going to check for questions. Okay, so now I think we will be wrapping up our webinar, and I would definitely agree with Yanni as to him talking about how for AMR we're having currently a more top-down approach to bring change rather than a bottom-up. And I think with the engagement of civil society, this is where IFMSA really comes in, for us to be spreading awareness among medical students and among general population of our of our countries, to make them more aware and to push for AMR to be aware themselves, and then to push for AMR to their governments to advocate for and to implement policies on. So I'm gonna open the floor for speakers if they want to say any last thing. I'm gonna start with Saad. Do you want to say something to at the end?
Thank you, Nishwa. Just want to thank everyone that have been working on AMR all over the year, and all those who did a great work promoting this cause. It's true that it's a new topic worldwide, but it's really one of the most important, if not the most. So keep working on it. And if you have any question, feel free to reach the SCOF IT, your general assistant, the program coordinator, and there are a lot of people who are working on it. So it's time for you also to do so.
Thank you very much. Mahmoud, would you like to go next?
I would like to thank to every one of the speakers that's at the beginning, and I would like to thank also the other small working group members, and Umniya, Ghaida, and Nashwa. Thank you so much for your help. And of course, I'm so looking forward to our success as IFMSA in our AMR advocacy journey that may have started in NMOs such as Morocco and Tunisia, like we have seen today. And I'm so looking forward to the other success in other NMOs. And yes, good luck for all of us. Thank you.
Thank you very much. Yana, would you like to say something at the end?
Not really. I said most of the things. I'm really glad that EMR is really working on AMR. And in case you have any questions related to AMR advocacy, something you've been wondering about, so I'd be more than glad to help you. And obviously stay tuned for the Innovation Challenge, which will be launched really, really soon. Bye.
Thank you very much. Omnia?
Yes, so I'd like to thank everyone who made the time to attend our webinar, and also I hope that you have made the most out of it and it was beneficial and useful for you, and hopefully it will empower you as well as for the advocacy toolkit once it's released, to further empower you and motivate you to start working on this topic that we as speakers in this webinar, as the amazing small working group members who worked on the toolkit, as the activity coordinators who are all passionate about this topic, who really believe in the gravity of it and the significance of its consequences, and how to finally change the behavior of the general public and the policymakers towards this topic and highlight it to be tackled as many topics like HIV and other critical public health issues, because it is, and I know that we all believe in it. And thank you all for being there.
Thank you very much, Omnia. At the end, I think there's a phrase that we use a lot that you might have heard of, which is, if not now, then When, if not us, then who? And I think this is very, very applicable for AMR and us medical students and the civil society. So it is time for action, and it is really time for getting down to business and starting anything. We're always here to provide you with resources. If you ever need something, please feel free to contact Omnia, Yone, me, or any of these activity coordinators who've done these amazing activities, and they'll be more than willing to help you out to develop these activities in your NMOs as well. So from ending this webinar now, thank you very much, everyone, once again, and bye-bye from our side.